Hey everyone, welcome back. Today we're going to do a deep dive on something I think a lot of people are curious about.
Yeah, absolutely.
IV complications. We're doing this one for you specifically
Yeah.
because you asked for it. Basically, you wanted a good overview of IV complications, like the common things that could go wrong, just in a way that's clear and
Well,
simple.
easy to understand.
Yeah. Whether you're totally new to this whole IV world or just need a refresher, this one's for you.
Absolutely.
And I think it's really smart to be thinking about this stuff. Because
Yeah.
most of us at some point in our lives are going to have an IV.
Oh, yeah, for sure.
So the more you know about what could happen, the better you can advocate for yourself.
Exactly.
Yeah.
Exactly.
So we're going to cover the big ones today, like infiltration, extravasation.
Mm-hmm.
We'll talk about phlebitis,
Why not?
also infection,
Infection. Yeah.
and then a rarer one, but kind of scary one, air embolism.
Yeah. Definitely got to talk about that.
Okay, so let's jump right in. First up, infiltration and extravasation. These are the ones that always kind of trip me up.
Okay.
What's the difference?
So think of it this way. Both of them, the IV fluid, it's like it's taking a detour.
Okay.
It's going outside of the vein.
Right.
But with extravasation, it's not just the fluid. It's the medication that leaked out that's actually the problem.
Okay.
So think about something like chemotherapy drugs.
Mm-hmm.
Really powerful, but if they leak into the tissues,
Oh, good.
that's when it can cause some real damage.
So it's not just the fluid going astray, it's the medication itself
Exactly.
that makes extravasation so risky. Okay, so how would you even know if this was happening? Like, what are the signs?
So, some swelling, that's normal with an IV.
Right.
But if you see a lot of swelling,
Okay.
or it feels really tight, or it's painful,
Mm.
or the skin around the IV site starts to feel cold or look really pale, like almost white,
Uh-oh.
that's a sign that something's not right.
Yeah, that's more than just like a little puffiness.
Exactly.
Okay, so what's something that, someone might just think, oh, this is just like a little thing,
Right.
but it could be a sign of something serious.
So a little bit of tenderness at the IV site, that's pretty common.
Okay.
But if the pain is getting worse, or if the area starts to feel hard, almost like a rope under the skin,
Oh, wow. Okay.
yeah, that's when you want to flag it to your nurse or doctor right away.
Got it. So let's say you suspect infiltration or extravasation. What do you do?
First things first, stop the infusion
Okay.
immediately.
Okay, hit the brakes.
Yeah, absolutely. And then elevate the arm or leg where the IV is.
Okay.
That can help with the swelling. And then, depending on the medication that was infusing.
Right, because that's a big factor.
Exactly. You might need a warm or cold compress, but that's where your healthcare provider comes in.
Okay, so stop, elevate, and call for
Right.
backup.
Yep, that's the plan.
Got it. All right, so moving on, we got to talk about phlebitis and thrombophlebitis. Those sound kind of scary. Like an angry vein situation, is that right?
Yeah, that's a good way to put it. So phlebitis is basically when the vein gets irritated.
Okay.
It's kind of like, imagine a road that gets all bumpy and rough from too much traffic.
Mm-hmm.
That's kind of what's happening to the vein. Now, thrombophlebitis, that's a little bit more serious.
Okay.
It's still inflammation.
Right.
But now you've got a blood clot forming in the vein, too.
Oh, so that's the added complication.
Exactly.
Okay, so I know that some redness around the IV site is normal. Right.
Yeah, you'll probably see a little bit of redness.
So how do you know when it's like, okay, this is normal versus I need to call the doctor right now?
Good question. So if the redness is just right around the IV site and it's not spreading,
Okay.
it's probably fine. But if it starts to spread out or the area feels hot to the touch,
Mm.
and especially if the vein feels hard and cord-like you can really feel it under your skin,
Oh, I see. Okay.
that's a sign that that vein needs a break from the IV.
Okay, so those are the red flags. Got it. And of course, we can't talk about IV complications without talking about infection.
Right.
It seems like anytime you have a break in the skin, there's a risk of infection.
Absolutely. That's always a concern.
So with IVs, what kind of infections are we talking about?
So you can have a local infection, which means it's just around the IV site.
Okay.
But if bacteria get into the bloodstream, it can spread throughout the body,
Oh,
and that can lead to something called sepsis.
right, which is really serious.
Yeah, sepsis is a life-threatening condition.
So definitely something we want to avoid.
Absolutely.
What are some signs that an IV site might be infected?
So look for things like increasing redness and swelling,
Mm-hmm.
but the swelling will be warm to the touch.
Okay.
And if you see any drainage that looks like pus,
Yuck.
yeah, that's a sign of infection.
Right.
And you might also have a fever or chills.
So those are some pretty clear signs.
Yeah, those are definitely red flags.
Okay, so let's talk about prevention, because obviously there's a lot that healthcare providers can do to try to prevent infections.
Absolutely. Prevention is key.
So what are some of the key things they should be doing?
Well, first and foremost, sterile technique is absolutely crucial.
Okay.
We're talking like surgical levels of clean.
Wow.
So that means meticulous hand washing,
Right.
wearing sterile gloves, using sterile equipment, and really thoroughly cleaning the skin at the IV site before and after they insert the catheter.
So basically just being super careful and clean.
Exactly. You want to minimize the risk of any bacteria getting into that IV site.
Yeah, that makes me feel better as a patient, knowing that they're taking all those precautions.
Absolutely.
Okay, so let's move on to the last one on our list, which is air embolism.
Okay.
This is the one that's a little more rare,
It is rare.
but I think because it's rarer, it's kind of scarier, you know?
Yeah. People don't really know much about it.
So let's break it down. What exactly is an air embolism?
So basically what happens is air bubbles get into the vein, and if the air bubble is big enough, it can actually block the flow of blood.
Oh, wow.
So it's literally a blockage in the vein.
Like a traffic jam.
Exactly, like a traffic jam in your circulation.
Okay, so it's not just about air getting in.
Right.
It's about the size of the bubble.
Yeah, a tiny air bubble, probably not going to cause a problem,
Okay.
but a large air bubble, that's when it can become dangerous.
So what are some of the things that people should watch for? What are the signs of an air embolism?
So the symptoms are usually pretty sudden and dramatic.
Oh, okay.
You'll see things like sudden difficulty breathing,
Oh, wow.
chest pain,
Okay.
and you might notice a bluish tinge to the skin, which is called cyanosis.
So those are all pretty alarming signs.
Yeah, if you see those signs, you need to get medical help immediately.
Okay, so what should you do? Like, what's the first thing you should do if you see those signs?
It's a medical emergency. So the first thing you do is clamp the IV line,
Okay.
stop any more air from getting in. Then you want to position the person on their left side
Okay.
with their head down.
What does that do?
That actually helps to trap the air bubble in a certain part of the heart so it doesn't travel to the lungs.
Oh, I see.
And then get them 100% oxygen as fast as possible.
Okay, so those are the key steps.
Yep, that's the emergency response.
All right, so stepping back a bit, not everyone's at the same risk for all these complications, right?
No, definitely not.
So what are some of the things that can make someone more likely to have an IV complication?
Well, your age plays a role.
Okay,
Your overall health.
makes sense.
If you have any existing conditions like diabetes
Mm-hmm.
or a weakened immune system,
Okay,
those things can increase your risk.
so it's not just the procedure itself,
Right.
it's also your individual health factors.
Exactly.
That makes sense. What about the procedure itself? Like, what are some things that could increase the risk?
Well, the skill of the person inserting the IV is a big factor.
Oh,
So their technique, what type of catheter they choose,
Ugh.
right? Even how long the IV stays in, all of those things can affect the risk of complications.
it's good to know. So I guess, if you're about to have an IV, what are some smart questions you could ask your healthcare provider?
That's a great question. I think it's always a good idea to ask about their experience with IVs.
Yeah.
How many they've done, what their success rate is like.
Mm-hmm.
Ask about the steps they take to prevent infection.
Right, because we talked about sterile technique.
Exactly. And definitely ask about what type of catheter they're planning to use and why.
Okay.
Because different catheters are appropriate for different situations.
And of course, don't be afraid to ask about the potential complications
Yes.
and how they would be managed.
Because that's really what it's all about, right?
Yeah,
Being informed and empowered.
exactly. It's about being an active participant in your care,
Exactly.
not just passively going along with whatever happens.
You have a right to ask questions.
Right.
And to understand what's going on.
Absolutely. Well, I think we covered a lot today.
We did.
We did a good deep dive on IV complications.
Yeah, good overview.
But remember, this is just the starting point.
Exactly.
If you're interested in learning more, there's a ton of information out there.
Oh, yeah, absolutely.
So keep exploring and stay curious.
Keep learning.
All right. Thanks for listening, everyone.
Thanks for having me.
We'll see you next time.
See you later.
You've been listening to the Learning Podcast, a production of Metanesta. Remember, learning is a journey. One step, one insight, one skill at a time. We'll see you next time. Keep learning, stay curious, and as always, be awesome.